What's going on, Staten Island? Welcome to another edition of Together Aside Business Spotlight, a chat with someone from the small business community on Staten Island. My name is Todd, reporting for the Staten Island Advance. And today our conversation takes us to Joseph Conte. He's the executive director for the Staten Island Performing Provider System. Give us a little history and what it is you guys do.
We are a healthcare organization. Our parents are Staten Island University Hospital and Richmond University Medical Center. And we were formed 5 years ago for the Medicaid redesign project. And over the past 5 years, we funneled about $130 million into healthcare provider and social service organizations throughout the community, primarily working with the Medicaid and uninsured population.
Dealing with healthcare, I can only imagine what it's been like the past few months there, Joe. Tell us a little bit about what happened once we heard about the pandemic coming. March hits. We're in quarantine. What did that mean for you and your business, Joe?
It's a seismic shift in the way we did our work. In many respects, our focus was on things like chronic disease management, behavioral health, substance use disorder, which still are important. But obviously, COVID overshadowed all of that. And we reappropriated our staff and our funds to work with the providers who were really on the front line of dealing with how COVID was impacting our populations.
What were the overlying concerns the past few months? Obviously, you just mentioned providing a support to those who really needed it on the front line and essential workers. Now moving forward, and even during now, as we are in phase two, as we're calling it, of the reopening of New York City, right? What are the concerns now? What's the overriding of the long-term concerns? Or what are the short-term concerns, Joe?
So it's really a very insightful question, because phase two, we're no longer in this acute phase, but the ideas and the focus on prevention, the focus on returning to some semblance of normalcy is important for the population at large. So in many respects, what we've tried to do is use social media to engage all the people of Staten Island, not just the Medicaid or uninsured population, about some important and smart things that they can do to prevent a recurrence of COVID. We've also distributed to the population over 25,000 face coverings. And we've used our, as I mentioned, social media presence, our website, text messaging. We send out about 70,000 helpful reminders a week to the community of Staten Island, and we get a tremendous number of hits back to our webpage when people looking for resources, important things that they should do, certain things that they should not do. Chronic disease is not something that can be put off for long in terms of management. So people who have diabetes or hypertension, cardiac disease, behavioral health issues, these things don't go away during COVID. They kind of get tamped down in terms of the priority. But if you need to have those conditions managed, it's very important that they do get addressed by your primary care and specialist. People are afraid to go to the doctor's office, and I think at first that was not an unreasonable fear, but now we have caught up with the preventative strategies, the hygiene, the PPE, and all of that, and people need to get back to their doctor's office. We've also spent a great deal of time providing our providers with telehealth services, so people can get care from their homes without ever leaving. And this is really important. And the ability to do testing, of course, is important. But we have great partnerships with all the providers in our community. And that has been a real bright spot of COVID.
One point you said was the use of digital media in order to reach out and get the word out. And next was telehealth. Do you foresee that being not a crutch, but a vital component in staying in touch with people and also being able to provide care, as you say, via telehealth? Because my question always is usually, now we're looking forward, how do you guys function as a company's business? Is that what you think you're gearing towards now, Joe?
Yeah, it's a really great point. 5 years ago, we were involved in telehealth in nursing homes, in our primary care practices, in the developmental disability organizations, CP Unlimited in particular, as a statewide organization. So we foresaw that the telehealth was going to be a priority item in terms of access, in terms of getting the right utilization, keeping people from unnecessary utilization of the emergency room or transfers of high-risk patients into the ER is something that we recognized was a a priority issue. So telehealth is here to stay.
I think it's fair to say everything's been fast tracked, and things are have to move forward, but have to move forward in a safe and secure way, right? Last thing, Joe, just give me a silver lining here. Whether it's looking forward, plus some positive takeaways from the past few months for you personally and or the business.
Well, from a personal standpoint, the ability to spend a little bit more time with family is something that I have greatly appreciated. And from the standpoint of the business, I think what we have been able to do is validate a lot of the work that we have been focusing on for the past 5 years. So we've been spending a great deal of time and developed our own way of assessing the community at large, and have done using a technology that we developed ourselves here on Staten Island, a tool called WeCare. And we can evaluate individuals in person or remotely and see for things that they need, like food or housing. All of these things are priority issues, and if they're managed properly, can improve a person's health, and if not, they can cause their health to deteriorate. So a lot of the work that we have been doing really came into the spotlight, and we're really happy about that.
I got to say, Staten Island is very grateful for what you guys have been providing. So really appreciate you sharing that, and looking forward to you guys continue doing what you're doing. And thanks so much for the time today. Really appreciate it.
It's a real pleasure to speak to you and to your viewers.
Thanks so much for joining us on this edition of Together SI Business Spotlight. Really appreciate the time. My name is Todd reporting for the Staten Island event. Looking forward to seeing you next time.